Hi class, and welcome to the skeletal system. As you go through these videos and when you're studying the bones on your own, make sure you always have your bone master list out in front of you so you know what bones you need to look at and all the landmarks that you're responsible for. Always try to use the real bones in the class or down in the BRC to study. A three-dimensional bone, especially if it's a real bone and not one of the plastic ones, you can see so much detail with these landmarks. So let's get started. And I have this cool app that I downloaded. It's called Essential Skeleton. It was 99 bucks. And I'm still trying to learn how to use it. I've been messing with it for 2 days and not doing a very good job. But let's see how we do. Now, if you look at your master list, you're going to see there's two subdivisions of the skeletal system, the axial skeleton and the appendicular skeleton. So the axial skeleton forms the axis, A-X-I-S, of your body. It includes the skull, the vertebral column, the spine here, and the rib cage, the ribs and the sternum. The appendicular skeleton is everything else, and we'll be going through all the bones of the appendicular skeleton too. So we're going to get rid of the appendicular skeleton for now. Au revoir. Get rid of the rib cage, and let's get rid of the spine, and we are going to concentrate on the skull. So with the skull is actually formed by 22 separate bones. 22 separate bones. They're joined together by joints called sutures. These are immovable joints. They look like little seams. And if you have access to a real skeleton, these are so cool to see. A lot of detail in those sutures. So all these individual bones are held together by sutures. The only bone in the skull that is movable is the mandible. When you're talking, it's going up and down. When you're eating, this is a movable joint. Everything else is immovable. And the first 8 bones that we're going to go through are called the cranial bones. If it is a cranial bone, it means part of it touches the brain. A part of the bone is in contact with the brain. So the first one you have is the frontal bone. If you look at your master list, it says frontal parentheses 1. That means there's just one frontal bone. This is the frontal bone. It's in the frontal region right here. So it tells you where it is. So there is the frontal bone. Now what do you need to know on your landmarks of the frontal bone? You need to know the orbital plate. The orbital plate, if it says orbital, we're talking about the eye orbit, the eye socket. There are 7 bones that form this eye socket of your skull. And if you look at the frontal bone, it pretty much forms the roof, the top part of this eye socket. So that is the frontal bone. And the other thing you need to know is the coronal suture. And the coronal suture, let's get the top of the head. Let's bring it down a little bit. So this is the front, this is the back side. The coronal suture right here, it's in the coronal plane. Remember, a coronal plane divides something into a front part and a back part. So this is the coronal suture. This coronal suture is joining the frontal bone with the next 2 bones that we're going to be looking at. And it will be the parietal bones. We have a left parietal bone and a right parietal bone. Two parietal bones. And there are our two parietal bones. So what do you need to know on the parietal bones? Well, in the center, they are joined together by a suture right in the midline here. Now, what plane is right in the midline? We have a sagittal plane here. This is the sagittal suture. So the sagittal suture is joining the right and left parietal bones together. Look how much real estate those parietal bones have on the skull. Pretty big. Now on the back part of the skull, we are going to be coming to another bone. Oops, I don't want that. We're coming to another bone, the occipital bone. Now you guys have already kind of know this. This is the occipital region, right? The back of the head. This is your occipital bone. Now the occipital bone is joining the two parietal bones by this suture. There's a suture right here in the back called the lambdoid suture. Lambdoid suture. And what's also on your list? You have the external occipital protuberance. So a protuberance is something that's sticking out, it's protruding. So if you look at, let's just kind of see if we can make this a little bit bigger. Right in the midline here, there's going to be this ridge, kind of a thickening of the skull right here. Now if you feel back in your own occipital bone back there, try to feel that bump that's kind of in the midline here. That is the external occipital protuberance. And that is where a bunch of muscles, they're going to be attaching onto this area. So now let's look at, I want to look at the base of the skull. Here's the occipital bone. And do look at the occipital bone by itself. It's kind of cool if you see the occipital bone isolated from all the other bones. We have this in our classroom, and I will have them out for you to look at them too. So what else do you need to know on your occipital bone? You need to know the foramen magnum. Now the foramen magnum, when you hear the term foramen, a foramen is a hole through a bone. It's any hole in a bone. You've got lots of holes in bones that we'll be going over. So anytime you hear the term foramen, just think of a hole in a bone. Foramen magnum. Magnum because it is huge. It's the biggest hole in the skull. And this foramen magnum is right at the base of the skull. This is where the brainstem sits right up in here, and the spinal cord is basically a continuation of the brainstem. Once it goes through this foramen magnum, it is now the spinal cord. So very important hole there. And then we have our last thing on our landmarks is occipital condyles. Now when you hear the term condyle, that is a smooth, rounded, articular process. Remember, a process is anything that tends to stick out of a bone, but this is an articular process. Remember, articulations are joints where two bones come together. Where this is an articular process, and this is covered with articular cartilage because it's going to be articulating with another bone. It's going to be C1, the first cervical vertebra that we have. So here are your occipital condyles. So that is your occipital bone. Not too bad, right? Now we're going to go to temporal bones. Now we have a left temporal bone. There's two of them. And we have a right temporal bone. So those are our two temporal bones. Our two temporal bones. Obviously, the best way to see the temporal bone is in the lateral view of the skull. Lots of landmarks on this bone. So the first one is the zygomatic process. A process is anything that tends to stick out of a bone. So the zygomatic process is this guy, oops, I don't want him, is this thing that sticks out of the temporal bone right here. You can see it on this view too, where it's just kind of sticking out here. So this zygomatic process of the temporal bone is articulating with this bone called the zygomatic bone. So the zygomatic process, it tells us it's going to the zygomatic bone, zygomatic process of the temporal bone. The external auditory or acoustic meatus. A meatus is a canal or passageway through a bone. This is basically your ear canal. This is your ear canal. External acoustic meatus. The styloid process. Remember, a process is something that tends to stick out of a bone. Here is the styloid process here, and you can see the styloid process on the other temporal bone there. Back in the day, there was things called vinyl records, and vinyl records had needles. And when we put the needle on the record, it was the stylus. The stylus was the needle. So that's why they call this, looks like a needle, a stylus, the styloid process. Most of our real skulls, this has long since been broken off, very fragile. We have one skull, it's still intact, so be careful. Easy to break this little guy. Styloid process. Then we come to the mastoid process. This is behind the ear. Here, if you put your finger in your ear canal, your ear is going to be right here. And then if you feel behind your ear, you're going to feel this hard bump back there. That is the mastoid process. And once again, all these terms were given names by anatomists who were all male, and they looked at this and they saw a breast here. Mastoid means breast, like a mastectomy, removal of the breast. So they gave it the term mastoid. So this is the mastoid process. Then we're coming to a fossa, mandibular fossa. Let me move this guy up a little bit. So the mandibular fossa. A fossa is a shallow basin in a bone. So a shallow depression in a bone. And it's called the mandibular fossa because this bone, the mandible, is articulating with the temporal bone at this junction. So this is actually forming your temporal mandibular joint, your TMJ joint. So there's going to be a mandibular fossa right in here. This is your hyoid bone. I am going to get rid of that. That's just getting in the way. I'm going to get rid of that hyoid bone. So we got rid of that hyoid bone. So here you see the two temporal bones, and the mandibular fossa is going to be right in here. It's a little depression where this is the head of the mandible articulates with the temporal bone. And we can pop off the mandible and it'll be easier to see this little depression right there. But I'm not going to pop it off of him. It just take me too long. But in class, or you make sure you do that so you can see the mandibular fossa right there, where the head of the mandible goes. And what else is on your list? The squamous suture and the squamous portion of the temporal bone. So the squamous portion, what does squamous mean? You just learned that in the epithelial tissue. Squamous means flat. So this flat and thin, this is the squamous portion of the temporal bone. I will show you a disarticulated, meaning the temporal bone all by itself, a real one, and you will see that this is very thin bone right here. This is the thinnest bone in all of the skull, the squamous portion of the temporal bone. When you hold it up to light, you can see light shining through it. It's so thin. So if you're a boxer, this is where you're told to hit your opponent. Hit them right here in the skull, because if you're going to fracture their skull, this is the easiest place to fracture it. I just don't get that, but that's what they do. So the squamous portion of the temporal bone, this is the squamous suture. The squamous suture that is connecting the temporal bone to the parietal bone. And then we have a carotid canal that's going to be on the bottom side. We have a carotid canal and we have a jugular foramen. Now the carotid canal, let's do the jugular foramen first because it's easier to find. Here is the occipital bone, right? This is the occipital bone. Here's the temporal bone. At the junction of the occipital and temporal bone, there's going to be a foramen here. It's a little more jagged looking than this in a real skull. That is going to be your jugular foramen. Jugular foramen on both sides. The jugular foramen is a hole, and that is where the internal jugular vein, a vein is going to be draining the used up deoxygenated blood that the brain's used up, and that internal jugular vein is going to exit the skull through the internal jugular foramen. So we'll be putting pipe cleaners in here so you can see it better. And just superior to it is going to be the carotid canal. Carotid canal. And we'll be putting a pipe cleaner through here too. It's a nice rounder looking hole. You can't really tell here, but it is. So the jugular foramen at the junction of the occipital and temporal bone, and then just superior to it is the carotid canal. Now the last thing we need to look at is the petrous portion of the temporal bone. Now the petrous portion of the temporal bone is actually, you can't view it from the outside. You have to take off the top of the skull here in your model, and then you can see it. So let's see, we're going to fade all the others, and you can kind of look inside, and you're going to see a thick ridge of bone in here. This is the hardest part of the skull, the petrous portion of the temporal bone. This is just a continuation of the external acoustic meatus. If you just follow it, the canal all the way through, that canal is actually leading into this petrous portion of the temporal bone. There are 3 tiny little bones in here. Those are the bones of hearing. They're enclosed in this petrous portion of the temporal bone. They're very delicate, so they're protected by this thick bone. So make sure you look at that petrous portion in there. Now we are going to go to the sphenoid bone. Now the sphenoid bone, I will be giving you an individual disarticulated sphenoid bone, because this bone, there's only one of them. I'll click on it, but it is kind of difficult to visualize. Once you have the disarticulated sphenoid bone and you look at it with your articulated skull, it will make sense, but it's going to take you a while to figure it out. So, but this is the part of the sphenoid bone that you can see from the outside. There's a lot of it that you can't see that's on the inside. So let's just start with what we can see. So you know this is the frontal bone right here. This is the frontal bone. Here's the parietal bone. Here's the temporal bone. This is the sphenoid bone. Now this is the greater wing of the sphenoid bone. So they come up on both sides, the greater wings of the sphenoid bone. See them here, the greater wings of the sphenoid bone. And then if you look in the orbit, you're going to see the sphenoid bone makes up quite a bit of the orbital, the orbit. There's going to be a nice round hole here on both sides, a nice round hole here. This is the optic canal. Optic canal, that is where the optic nerve is going to be leaving your eye and it's taking information into your brain. So that optic canal is where the optic nerve leaves this bony orbit. And just to let you know, and you'll need to know, that optic canal is going through the lesser wing of the sphenoid bone. It'll make more sense when we look inside the skull and you can see that part of the sphenoid. Then we have structures called the superior orbital fissure. Here is the superior orbital fissure. The inferior orbital fissure is going to be this crack down here. It's made up partly by the sphenoid bone and partly by some other bones too, but superior orbital fissure, inferior orbital fissure there, and the optic canal. And on the base of the skull, let's move this guy around. On the base of the skull, I can't get it. Can't really see it too well. Well, here you can see it better. On the base of the skull, you're going to see these look like feet sticking down. Now, this is called the pterygoid process. You have one on the right and one on the left. The pterygoid, the P is silent, pterygoid process. Remember, a process is anything that sticks out of a bone. That is the pterygoid process. You have a medial and lateral plate. Medial and lateral plate. I'm going to go ahead and just hide all the others so we can just see the sphenoid bone. Now this is the sphenoid bone if you're looking from the inside. So here is your carotid canals, just to get you oriented, you know what I mean, oriented to the bone. If we put pipe cleaners in here, you're going to see a pipe cleaner crossing this way and crossing this way. And they're crossing over something called the sella turcica. It's like a little cup. They call it a Turkish saddle. That's what sella turcica means. But I don't even know what a Turkish saddle is, so I just call it a little cup. It's a little U-shaped cupping. And inside this little sella turcica is going to be a very important gland, a pea-sized pituitary gland. Very important gland. So this is the sella turcica right there. Oh boy. Now if you look at it this way, here is the lesser wing right here. You can kind of see where the optic canal goes through the lesser wing. This is the greater wing coming up. The greater wing member goes to the outside of the skull here. So the greater wing, the lesser wing, and here are the feet sticking out. This is the pterygoid process. So take a look at this bone. Here's the front part of the bone. Always just try to figure out where the carotid canal, the optic canals are. And the sella turcica is always going to be internal. The sella turcica is always going to be internal. There's going to be your sella turcica. I just want to show you one more view of the sphenoid. So actually we're going to fade the others so you can kind of see how it fits in the skull here. So this is a pretty good view of how it fits in the skull. All the way around. So the dark green is the external parts that you can see. The light green is internal. So let's just look at it this way here. So when you look at it this way, here you're going to see the sella turcica right here. Here is the continuation of the optic canal. Here is your lesser wing. And then the greater wings are going to be coming up this way. I think that's basically, we got the lesser wing, greater wing, optic canal, sella turcica, the pterygoid processes, and the superior and inferior orbital fissures. So we've got the sphenoid covered. So that is your sphenoid bone. So just make sure when you're studying the sphenoid you have a disarticulated one also so you can figure out this bone. It's not that hard once you figure it out. Now our next bone is the ethmoid. So let me see if I can bring up the ethmoid. Now this is a little bone, but boy, it has lots of landmarks, and we do not have a really good intact real ethmoid bone. I will show you one. It's very, very light. It's like paper thin, very delicate bone. So most of them have been long since destroyed, and the plastic ones don't even look like it to me. So the ethmoid bone. So this is what we're going to look at the landmarks that you can see from an external views. So the first thing that you're going to see is this guy. If you look inside the nose, we're going to have something called a nasal septum. It's a bone. A septum is something that's going to divide another structure into two rooms, two parts. So the nasal septum, it's formed by the union of two bones. One of them is the ethmoid and one of them is the vomer. We'll get to the vomer a little bit later. But this is called the perpendicular plate of the ethmoid bone. It sticks straight down. Perpendicular plate of the ethmoid bone. And then on either side of the nasal cavity, on the lateral walls, you're going to have this little outpouching here. It looks, well, you'll see it on the real skull. We have one skull that still has it intact. This is called the middle nasal concha. The middle nasal concha. So this is part of the ethmoid bone. There's going to be a superior nasal concha up here, but you'll never probably be able to see it. And then you're going to have this part of the ethmoid bone. This is one of the 7 bones that forms the orbit. So the ethmoid is one of the 7 bones that forms your orbit. And that's about all you can see from the outside. So now let's just fade all the other bones so we can see what the ethmoid looks like. So this is the ethmoid and how it sits in the brain. Well, not in the brain, but how it sits on the inside too. Now you remember your frontal bone, right? So with the frontal bone, we had this little space right in here. So there's this space in the frontal bone, and guess which bone sits in there? So let's go back to our ethmoid bone. The ethmoid bone is sitting in that space. Come on, go back up here. The ethmoid bone is sitting in that space. So the frontal bone kind of cups it on both sides. So here we have the ethmoid bone. And now this one, make sure you can see it in the skull. So when you take the skull cap off here, you're going to see this little structure here. It has little holes in it. This is called the cribriform plate of the ethmoid bone. The cribriform plate. Now this cribriform plate, it's in contact with the brain. There's going to be a cranial nerve that lays right over each side of the cribriform plate. It's cranial nerve 1, it's the olfactory nerve, and that olfactory nerve is picking up smell. And it makes sense when you think, well, here's the nose, and you breathe in, that smell is going to percolate up through the little holes of the cribriform plate of the ethmoid bone, where the cranial nerves, the cranial nerve 1, the olfactory nerve, is going to pick up the smells. So the cribriform plate has the little holes, and you're going to have this structure that's sticking straight up in the midline. This is called the crista galli. Crista galli. It's a midline structure. It's actually holding the dura that's dividing the 2 hemispheres of the brain. So the crista galli, also part of the ethmoid bone. So the ethmoid bone has quite a bit of things. The cribriform plate, the crista galli, the perpendicular plate, which is helping to form the nasal septum, the orbital plate, it's contributing to the orbit of the eye, and the superior and middle nasal conchae. Conchae is plural. Here is the middle, the superior, probably not going to be able to see. So that is the ethmoid bone. So one last thing before we finish off with all our cranial bones, what I'd like to do is I just want to fade out these parietal bones. Actually, let's just remove them. Let's just hide them. So we've kind of taken off the cap of our skull. There is going to be three internal cranial fossas. Remember, a fossa is a depression in a bone. And if you look at the skull, you got to have the real one to really visualize this. You're going to see an anterior and middle and posterior cranial fossa. There's like an upstairs, then you have your ground floor, then you have your basement. You're going to see three distinct levels. Up here you have the frontal bone. Here is part of the ethmoid bone. There's the cribriform plate with the crista galli. Here's the sphenoid. Here's the lesser wing. Here we have the optic canals. The sella turcica is right here. And then you're going to be dipping down into, this is all part of the anterior cranial fossa. You're going to be dipping down into the middle cranial fossa. Here's the greater wing of the sphenoid on both sides. Then you come to the temporal bone right here. Here's the petrous portion of the temporal bone. The petrous portion of the temporal bone is high. There's a high ridge here, and you're going to dip down into the posterior cranial fossa here, which is made up of occipital bone and part of the temporal bone here. And what do you think this opening is here? That's between the occipital bone and the temporal bone. That is the jugular foramen. The jugular foramen. So I think we've gone through all the 8 bones of the skull. Those are your cranial bones. And the next video we will go through the facial bones. Those are a little simpler to go through. So we'll see you soon. Bye.